there's one thing, if I had have known when I started on universal credit, was I should have applied for my HC1 form, because I discovered 6 months after I signed on to universal credit, when I was attending hospital appointments and had to isolate for quite a few of those occasions, that I could no longer afford to travel due to the loss of income. And I went to ask for the travel expenses that you normally get when you're on working tax credits, etc., that I wasn't entitled to it because I hadn't applied for the health support, which is the HC1 form that I was not made aware of when I signed on to universal credit. And then when I did apply for the HC1 form, I was not awarded the full amount, because my monthly income in that particular month that I applied for the support was higher than my normal income due to me receiving self-employment grants that month. So it put me over the monthly income. So yeah, basically, if you're applying for the HC1, apply for it when you sign on to universal credit, because if you need emergency dental treatment or your eye test emergency, you won't get it unless you have the HC1 form.
As we've just heard, the way that UC claimants get their help with health costs is fundamentally different to how those in receipt of an older legacy benefit do. If you were in receipt of working tax credits, income support, or ESA, you received a certificate in the post nearly automatically, which entitled you to help with dental treatment and sight tests. However, with universal credit, the responsibility is very much with you to make an application in order to access that same level of help. As we've heard, the form that you need to complete is called the HC1 form. This form is freely available online through NI Direct, and you can also pick it up at your local Jobs and Benefits office. Some GP surgeries, dental practices, and opticians also have copies of the forms readily available, so you can always ask when you're in there at your next appointment. There are 3 key things that I'd like to highlight when it comes to the HC1 form. Firstly, you don't actually have to wait until your Universal Credit Award has been decided before you make your application through the HC1 scheme. It is a means-tested assessment, so you need to be able to provide income, savings, and capital, but you don't have to confirm that you are in receipt of Universal Credit. Secondly, if your circumstances changed, you can get the level of help that you're getting through the Help with Health Costs scheme reassessed. As we heard in the example, because this person was receiving an additional pot of money, the help that they could get through the health costs scheme was reduced. If that does happen to you, you can ask through your Universal Credit Journal to get the level of help that you're getting reassessed. This may mean that you get more help in future. And thirdly, if you have incurred any healthcare costs within the past 3 months, it may be possible for you to claim those back. There are loads of additional notes contained within the HC1 form explaining how to do this, but it will normally require you to complete an HC5 form and to provide receipts as confirmation of payment. If you require any assistance with your help with health costs, you can contact your local advice agency who will be able to help you complete the form, or indeed help you negotiate with Universal Credit in order to get your level of help reassessed.